Chapter 5 Lab Kinetic Chain Checkpoints, Anterior View. This patient has, in his ankle and foot, we're looking for straight and parallel feet, not flat or externally rotated. This patient has his right foot externally rotated, his left foot slightly externally rotated. He is slightly pronated on both sides. His knees should be in line with his toes, not adducted or abducted. And currently they are both correct. His pelvis, it should be level, not tilting anterior or posteriorly. And that is good. His shoulders should be level, not rounded or elevated. And if we look at this person right here, this shoulder is slightly tighter than this shoulder is. This one has a greater slope than his right one. They are not rounded, however. His head position, it should be in neutral, not tilted or rotated. And his head seems to be in a good spot. Next, we are going to do the lateral view. So in the lateral view, the foot and ankle should be in neutral position with the leg vertically at a right angle from the sole of the foot. So if we look here, it does look like we have a good right angle. His knees should be in neutral position. Lift up your shorts, please. Not flexed or hyperextended. And he is not hyperextended, so that looks like it's in a good position. His pelvis should be at a neutral angle, not anterior or posteriorly rotated. However, I believe that his pelvis is anteriorly rotated, giving us that bubble butt or the curve in his low back. His shoulders should have a nice kyphotic curve and should not be excessively rounded in the front. He does have slight rounding, but it's not excessive as it would be for a swimmer or an upper body athlete. His head should be in the neutral position, not excessively extended or flexed. So we want to make sure that his head's not positioned out and that it's lined up correctly with his body, which I believe we are okay with. The posterior view, his foot and ankle, again, they should not be pronated. It should be parallel and not completely flat to the floor. He is duck feet, as we see, and he does pronate. And they are not lined up parallel or straight. His knees should be in line with his toes, not abducted or adducted. And again, I think that we're doing okay. However, he may have a slight valgus to his knees. His pelvis should be level, not tilted in any direction, and I believe that we are okay with those checkpoints. His shoulders should be level, not rounded, elevated, protracted, or retracted. He does not have a winging in his scapula, and his shoulders are not too far rounded. I would, however, probably work on his back musculature to bring him back to that neutral position. His head should be in a neutral position, not tilted or rotated in any direction. His hair kind of throws you off, saying that it comes over here, but actually he's lined up neutral and pretty good. And that is my Lab 5 video. In the presentation, I will talk about the musculature that he needs in order to fix his problems. Thank you.